So one of our treatment options we have here at HealthQuest is something called the dry needle therapy. It's been something that's been done for a long, long time, but only kind of recently have physical therapists really been started to get interested in this. It's based on the idea that if you use a mechanical stimulus, you can elicit a chemical response. So in the case of trigger points in muscles, like a sore, tight knot in a muscle, we can use a needle, like this little, I keep it in my Unicorn Believers Club lunchbox because it tends to make people kind of chuckle and laugh rather than be scared of scary needles. So we keep it in there. But these tiny little needles that we use are acupuncture needles. So you see how itty bitty little these things are. Monofilament needles. And the idea is that if we take one of these needles and we put it into a trigger point in a muscle, we can get the muscle to relax. Now, this is one of the things that we'll do in addition to exercises, balance and stability training, stretching, all the other things that cause the patient to get to the point where they have muscle knots and trigger points in their muscles. So part of the therapy that we do is this dry needling technique. So I'll just do a little demonstration. So if we're dealing with somebody that has perhaps plantar fasciitis, Achilles tendonitis, or just trigger points and muscle knots in their calf from various sports, athletics, or just wearing fancy high heels, going to a wedding and spending a little too much time on the dance floor. Not that you would ever do that. So what I'm going to do is something that all physical therapists all over the world know how to do is find trigger points. It's something we excel at. So in her case, I find a trigger point, right there. And I'm just going to introduce this needle to it, tap it in. As you see, not super scary. She didn't jump up and scream in pain or agony. And then I simply go looking for that trigger point. And I might get a little jump out of the muscle. I might just kind of feel it with the needle. Ah, there it is. So we find that. We tighten the screw on it a little bit, make it nice and tight. And then basically we'll do this at a couple of points. We'll do both legs. There's a really, really good research out there that says that dry needling therapy can be really effective. There's also good research out there that says if you treat the other side, you can even benefit the side that's painful. But this can be a really, really effective treatment option that we have. Other things that we can do this for, not just legs and feet and things like that, but I've had really, really good responses to people with neck pain, people with headaches. A lot of shoulder issues can really benefit from dry needle therapy. Sometimes it's as simple as somebody comes in, they got a really stiff neck, a big trigger point in their upper trap. Everybody kind of gets that little sweet spot. We can hit that and a couple other areas around the shoulder, and it's almost like a miracle. They feel absolutely amazing thereafter. It's not always that lucky, but sometimes we can have some really, really good responses with this. So in her case, it's just these tight calves from being on her feet an awful lot. We find a couple of trigger points in there. Not a real big concern for bacteria or germs or anything like that because the skin is a very, very good protective surface, and these needles are so thin, it's not like they're going to go and take a bunch of bugs down into your skin with you. So it's very, very, very safe. People do not get infections from dry needle. They usually don't get, there's no bleeding or anything like that. There's no bruising. And everybody in this company that is trained in dry needle therapy knows how to avoid things like arteries and veins and nerves and the lung tissue. So we're extremely careful with where we put these needles, how we put these needles. But once they're in, once your trained therapist puts these needles in, then we leave you to just relax and chill out for 15 minutes or so, and that tends to be all it takes for it to calm down. When she's done with this treatment, she's either going to be done for the day or she'll just go on and do her exercises or do whatever it is that we still need to do. It's not going to affect that negatively at all.